Because you want to you don't want that bacteria from underneath his foreskin to get into your body and cause you to have major problems. Because PID, if it's reoccurring in your childbearing age, then you're going to be infertile. Because it can actually damage the fallopian tubes and stuff like that. And y'all do know that what we talk about in this classroom stays in this classroom, right? Okay. But I have to tell you these things because with the different cultures that are in here, your mamas don't talk to you about things that need to be talked about. So I take that on myself. And you know, if it goes untreated, it's just going to get worse and worse and worse. What's Fitzhugh-Curtis? It's bad. It has stopped here and traveled up into your peritoneum. Okay, so it's going to infect everything that's there. Okay, look at figure 11.8. Oh, that wasn't actually. Okay. That's PID. That's PID. It's on page 245. Now, if you put in your transducer, is this image in sagittal or is it in transverse? It's in transverse. Do you see the uterus there? No. You see the uterus?
Endometrium.
Yeah.
Yeah.
Here's the uterus.
Yeah.
Here's the uterus. This one? Yeah. This is the uterus. That's the uterus. That's the uterus. Okay? Now, do you think you're going to find an ovary in that mess? No. Absolutely not. Absolutely not. This is the uterus. See the endometrium? This is the uterus. See the endometrium? This is the uterus. Very good. Very good. Okay. This is not unusual at what we see. Okay. But we still have to document, and if you don't see an ovary, how are you going to annotate that? Adnexa. Adnexa. Okay? So, I can't see diddly. I can take my images of the uterus and that's it. Okay? That's all I can do. So sagittal, right, adnexa. Superior, mid, inferior. At mid, I'm going to do with and without color. There's nothing for me to measure. Okay, there's nothing for me to measure. I can't see diddly. Okay, transverse, right, adnexa. Superior, mid, inferior. With and without color. Again, there's nothing for me to measure.
Is sagittal is go with superior or middle to lateral?
Oh, yeah. Thank you. Be lateral, mid, medial. Thank you, Dewey.
Yes, ma'am.
Okay? And if I want to add a cine in there, I do. I'm still documenting the area, but don't fight too hard. Okay? You know your patient's uncomfortable. Okay? Just do those quick images and just go to the other side. Yes.
We're not You measure the masses there, or the mix of masses?
If you can make the definition of it, I would,
Okay.
but a lot of times with that, you're, okay? Only you can make that call. Okay, because you're the one that is seeing it live. So if you see something you feel like you can measure it. If you can't make and decide about anything, don't measure it. But you have to label it. Don't label it ovary if you don't see ovary. Just label it adnexal. Okay? Okay. Y'all go to what's in the endometrium and what are the 3 different kinds of fibroids? You remember those?
Yes. With the.
You have 3 different kinds of fibroids.
Is it fluid? Okay. Yeah.
The fibroids have nothing to do with fluid. They are a
Just-
solid mass. They're heterogeneous. Now they can have areas of necrosis, but you can also have fibroids in the cervix. And if I'm childbearing age, then I'm gonna have a C-section, right? Because the baby won't be able to, the cervix won't be able to flatten out. It won't, they call that effacing, and it won't be able to dilate. And so I have to have a C-section, okay? But the main ones are submucosal, which deform the endometrium, intramural, they deform the myometrium, and subserosal, they deform the serosa and pedunculated. Okay? Okay, so let's talk a little bit about PID. PID is pelvic inflammatory disease. Women, this is why you should not douche. Okay? Douching is where we know we're gonna have sex that night, and so we wanna be clean, so we can clean ourselves. Okay, you can buy kits at the drugstore, or you could have a reusable one at home. Okay, if you do not get the one from home, if you have the one from home, you have to make sure that you clean it very well, because bacteria can grow inside the bag that can be reusable or in the tip. So what happens? I put warm water and vinegar because that's the one of choice. The old days, they would put warm water and alum. Alum is a spice. And so what happens is you put alum with your pickles. And what does it do to your pickles? It makes them nice and crisp. Well, when you douche with it, it kind of makes your vagina tighter, okay? You can make a paste of alum and put it on a pimple, and make a paste and wake up the next morning and the pimple will be gone.
What?
Okay, because it draws the infection out of the pimple. Okay, well, in the old days, people would douche with it, so that way it'd make their vaginas nice and tight.
Where do you find those?
At the grocery store. Yeah, it's a spice. It's a spice. Yeah, it's a spice.
Is it
That didn't sound right either.
A-L-U-N.
Upa, that didn't sound right
Mhm.
either.
Yeah, you just buy it at the grocery store.
Oh, pimple.
Something aluminum, it's a clear stone. This is like a clear stone.
A stone?
Yeah, like a stone, like hello? It's like a clear stone or
Okay.
no?
It's a powder.
Oh, but it has a powder. Yes,
It's
I
a
tried
powder.
it for my teeth. It helps.
Yeah,
Yeah, for pimples.
for pimples.
Yeah, yeah.
Yeah. Okay, so anyway, so let's go back to douching. So say you're camping, okay? So you haven't had a bath in 2 or 3 days, and then you know you're gonna have sex again. So you wanna be clean, so you douche yourself, and all of that bacteria goes up into your fallopian tube and into the peritoneum, and then you can get PID. Okay? If you don't keep yourself clean, or if your partner's not clean. If your partner's not clean also, then the bacteria can travel. I mean, it's just a track. It's open. The vagina is open to the cervix is open to the uterus is open to the fallopian tubes, and then it spills out into your peritoneum, and the next thing you know, you have PID. Okay? Or maybe you have a partner that has given you a sexually transmitted disease. Then he doesn't say anything to you. Yeah, you have a discharge, but that's not unusual for this time of the month. And then the next thing you know, your discharge has a brownish tint and it's kind of smelly. And then you decide that you need to go to the doctor. You have to wait a month before you can get in to see your doctor. I mean, the scenarios can just keep going and going and going. And the next thing you know, you've got PID. So they order a pelvic ultrasound on you, and it's so far gone that you can't even see your uterus hardly, because everything is kind of just mushed against it because of the inflammation that is in your pelvis. Okay, that's considered PID. Okay, now sometimes with an ectopic on the contralateral side, meaning what? The opposite side, you can go over there and you can see a hematosalpinx. Okay, they don't teach that in the books, but clinically I've learned that if I have an ectopic on my right side, go over to my left side and look for my fallopian tube. If I have a hematosalpinx, I have an ectopic. Okay? I have an ectopic. Because an ectopic is a pregnancy that is not at the fundus of the uterus. Okay? Because if it implants in the lower uterine segment, what happens? I have a placenta previa. So that warrants a C-section. Because the birth canal is blocked. And so I'll have to have a C-section. It's also the #1 reason for vaginal bleeding in the 2nd and 3rd trimester is placenta previa. Okay? I was going somewhere with that and I forgot all what I was talking
You
about.
weren't talking about douching?
No, finish that.
I have a picture of placenta baby. I'm gonna show you.
Oh, yeah. An ectopic can be anywhere. Okay? They can be at the fundus. They can be in the adnexa. They can be on the lateral side of the ovaries. So it's your job as a sonographer to be able to find those ectopics. Okay? And an ectopic is like the corpus luteum. It's going to have a ring of fire. Okay? It's going to have a ring of fire. So if I have PID, my body now says, okay, you have an infection, so what's going to be elevated with my labs? Huh?
HCG?
No, the white blood cells. Because God's going to send my white blood cells from my spleen to my pelvis because he's going to try to get me well. Because that's how our body works, right? Even if we hit the edge of the dresser with our arm, what's gonna happen? White blood cells are gonna go to that area to try to heal that bruise, okay? Well, the same thing with PID. The only thing is you're also gonna have a fever with it. You're gonna have dyspareunia with it. You're gonna have dysmenorrhea with it. Okay? So you're gonna have several clinical symptoms that are gonna go along with it.
I have a question.
Yes.
Is this has to do, this, inflammation has to do with, new things that they made, like guys has to surgery in their, to cut the excessive skin?
No.
Because
Oh,
it collects
yes,
bacteria.
yes, yes,
Uh-huh.
yes. If your partner is not circumcised,
Mhm.
okay? If your partner is not circumcised, that could be part of the foreplay. That you know he's clean, clean it yourself. Because you can't depend on, sorry guys, you can't depend on them cleaning themselves. Okay? And what happens is that the foreskin is, you have to pull it back, and sometimes that liquid gets kind of whitish and yellowy and it can smell. Okay? So if you don't trust your partner to clean himself, just incorporate that into your